Good morning, good afternoon, good evening. I guess it depends where you are. I hope 2014 has started well for you. So this presentation is about Buteyko method. Um, I've been, I've had the privilege to have been teaching the Buteyko method for around 20 years, which roughly coincides to when it first came to the West from Russia by way of my teacher, who was a certain Alexander Stelmatsky, protege of Professor Buteyko. This presentation is about Buteyko basics, and the most basic thing, the most important thing to understand about the Buteyko method is the discovery behind it. If you are looking for a quick fix, an easy, extremely simple idea, then this might not be for you. Because whilst the idea is simple, the willpower and work, commitment, learning and engagement is such that you will need some intellectual justification as to why you should practice the Buteyko method. And there are many good reasons why we should practice or understand or at least incorporate Professor Buteyko's discovery in order to reverse chronic diseases and in order to maintain robust health, or to at least try to attain reasonably robust health. Professor Buteyko was a Russian scientist, medical scientist, and he became an academician in the Soviet Union, which is a very high rank. To give you an idea, a medical doctor in the former Soviet Union would have the rank of second lieutenant. Professor Buteyko was an academician, which had the equivalency of a 3-star general. It was the height of rank that any scientist could possibly achieve in the former Soviet Union. He was basically only outranked by Politburo members, political elite, and very high-ranking officers of the armed forces and so forth. He made some discoveries to do with cardiovascular research and so forth, and was given the rank of academician at a fairly young age. He then was perplexed by his own chronic health problems, and he began to do some research. He personally had what is called antagonistic high blood pressure. One is not expected to live much past the age of 30 with this kind of condition. And he began to do research, and his research was based upon the principles of physiology, biology, biochemistry, and so forth. And he began to make comparisons between those who suffered with chronic disease and those who did not suffer with chronic disease. And what he found was invariably all people, without exception, who sustained any of the diseases of civilization. And we should just pause for a moment and I'll explain what those are. The diseases of civilization: asthma, allergies, angina, bronchitis, bronchiectasis, cystic fibrosis, diabetes mellitus, emphysema, COPD, hormonal problems, obesity, insomnia, sleep apnea, snoring. There are around 200 diseases of civilization. These days we call them chronic diseases. These are diseases separate to the categories of congenital diseases or, say, infectious diseases like malaria and so forth. Chronic diseases or the diseases of civilization just seem to arise spontaneously somehow. It may interest you, or may not, but it may interest you to note that the official position of Western contemporary medicine is that they do not know because of asthma, allergies, angina, bronchitis, bronchiectasis, cystic fibrosis, lupus, multiple sclerosis, all these diseases of civilization, chronic diseases. The official position, and you can check this with the British Medical Association, the Australian Medical Association, the American Medical Association. If you direct a question to the appropriate authority, what is the cause of multiple sclerosis? Don't know. What's the cause of asthma? No clue. What's the cause of COPD? All this category of disease has no known cause. So anyway, Professor Buteyko was interested in this particular category of disease, and he, through his line of investigation, you look alarmed, Abner. That's all. Sorry. Through his particular line of investigation, discovered that by our breathing, the way that we breathe will determine how much carbon dioxide it retains. It should be noted that babies, for example, do not generally sustain any of the diseases of civilization. There are exceptions when, in case the mother is very ill, and so the condition is passed on by some means. But generally speaking, babies don't have diabetes mellitus, emphysema, COPD. They don't generally have, schizophrenia or the sleep apnea and such things. And that is because, generally speaking, a healthy baby breathes extremely well. Those of you who are watching today and who are or have been mothers of babies will remember that, I think we might have a technical difficulty, I'm not sure.
It says it's good here.
Okay. You should check on your computer. The person goes to and it becomes a chicken and an egg situation whereby the organism loses carbon dioxide and the disease creates more loss of carbon dioxide, so it's quite a disaster. So Professor Buteyko, through his research, that people, as a prerequisite to developing these diseases of civilization, need to breathe more than they should. They need to breathe 2, 3, 4 times above what is physiologically recommended. And this is what he claimed is the cause of these diseases of civilization. As man has become more and more sick in the breathing and the health, it was because the way that we breathe determines our indigenous levels of carbon dioxide. Now you might have heard, some rumors and some ideas that carbon dioxide is a bad product, when in fact it is a necessary ingredient of all organic biological life. There is no life without carbon dioxide. Within the human organism, carbon dioxide determines the rate at which oxygen is released from blood into cells and tissue. This is known, is it working?
Doesn't make sense. The video's running, and then
I think we're having a technical difficulty. Back to Buteyko method. So this Russian scientist, this academician, Professor Constantine Buteyko, made his discovery that these diseases of civilization, these chronic diseases, this asthma, allergies, angina, bronchitis, bronchiectasis, COPD, emphysema, hormonal problems, obesity, even psychiatric behavioral issues, impotence, infertility, and so many. This whole classification, these diseases of civilization, as opposed to congenital and infectious diseases, had their genesis in the organism having a low level of, a less than optimal level of carbon dioxide, which is so essential for the proper functioning of the human organism. So he set about to develop a method, an approach, and of course, being a medical doctor, he tried the pharmaceutical approach. I mean, it's perfectly logical. If you could somehow change the breathing pattern by taking a medication, that would be helpful, and you could reverse so many of these disastrous chronic diseases. That ended in failure. He tried devices that constrict the breathing, that in an attempt to normalize the breathing. The problem was the respiratory center, which is located in the brain, in the medulla oblongata part of the brain. It's not psychological. It develops some homeostasis, some norm for respiration, and somehow, for multifactorial reasons, we are trained, or the way that we live our lives causes us to hyperventilate, causes us to breathe more than we should. As a consequence, we lose carbon dioxide. As a consequence, the body tries to defend and compensate against this loss. A good example of this would be asthma, in which the bronchus constrict to stop the level of carbon dioxide. The industrial medical approach is to defeat that compensation mechanism by expanding the bronchus with dilating medications. The same is done with high blood pressure and other diseases. They try to open the vessels, which constrict to prevent the loss of carbon dioxide, and as a consequence, the diseases get worse. Buteyko tried many approaches to try to normalize the breathing so that these chronic diseases could also be reversed. And what he discovered was there was a way to retrain the breathing pattern. And it has to be, it's the involuntary breathing pattern that has to be changed. There's not much point doing a helpful or relaxing breathing exercise for 5 minutes a day or 10 minutes a day or an hour a day when we breathe 20 to 30,000 times a day, and we do so involuntarily. So the involuntary breathing pattern has to be changed, has to be returned back to its optimal, and in doing so, the corresponding level of carbon dioxide improves, and consequently, those diseases which have their genesis in a low level of carbon dioxide will be reversed. I think Buteyko made his discovery a bit over 50 years ago, and tens of thousands of people in Russia were successfully treated. Around 20 years ago, the idea came to the West. It started in Australia with Professor Buteyko's protege. His name was Alexander Stelmatsky, and I think I was the first Western practitioner to be trained in this approach. And I have a small team of practitioners who work with me, and we've been teaching people this method. Well, I've been doing it for around nearly 20 years, and there are others in the team that have been doing it for 17 years, 10 years, 5 years, and so forth. And some of them have only just started. And we're able to do much the same thing that, that Professor Buteyko did and that Alexander Stelmansky did, which was we can show people how to reverse their asthma. You can, if your asthma is fairly mild, you can usually stop it within about a week or so. If you require a lot of bronchodilating medications, you may have to practice for a bit longer, but you will see results very quickly. And the same, when I say results, I mean improvement. The improvement will always be incremental. If you have just been diagnosed with multiple sclerosis and only have the first initial symptoms, loss of peripheral vision, heavy legs and so forth, you can reverse that condition or begin to reverse it within weeks, days, sometimes even weeks, and you can start to see improvement. If the condition has already advanced significantly, obviously it takes a lot more work and longer to get the sort of results that you might be hoping for. So it's an authentic method. The method is scientifically based. One needs to be coached. There's quite a bit of coaching involved. It can be taught in groups, 10, 20 people and so forth. And the idea, the singular idea, is to reduce the breathing. And by reducing the breathing, one elevates the organism's level of carbon dioxide. Now, reducing the breathing is a fairly simple concept, but the training actually involves retraining that respiratory center so that you're always breathing less when you sleep, when you exert yourself, when you work, when you are conscious of your breathing, and even when you are not conscious of your breathing is more to the norm. We see in today's society, breathing is becoming worse and worse. Professor Buteyko developed a test, a breathing test, and it's very simple. All you have to do is make a normal exhalation, not a deep or a full exhalation, but a normal exhalation. Hold your breath and record how many seconds you can hold your breath for after that breath out until you feel the first difficulty. That's when your respiratory center is being triggered. And if your control pause is around 50 to 60 seconds, then you will have no symptoms of any of the diseases of civilization or any chronic disease. If you have a high control pause, you won't have asthma, allergies, angina, bronchitis, cystic fibrosis. You won't sustain diabetes mellitus, arthritis, emphysema, or any of these diseases that have at their genesis a low level of carbon dioxide. If you can only hold your breath for, say, 30 seconds, it would imply that your breathing is not optimal, but you won't really suffer serious chronic ailments. If your control pause is less than that, then it is likely that you will suffer mildly asthma, allergies, angina, obesity, bad, cranky moods, insomnia, and so forth. And the lower the control pause, the worse your breathing, and the more susceptible you'll be to suffering from chronic disease. Doesn't matter if it's emphysema or diabetes or hormonal problems or obesity, schizophrenia, sleep apnea. I mean, the kinds of diseases that people are worried about are according to their genetic predisposition. One person may develop asthma, somebody else will develop diabetes mellitus, somebody else will become obese, someone else develops arthritis or multiple sclerosis or lupus or stroke or whatever. It doesn't really matter very much, but certainly if you have a low control pause, if you breathe 3, 4, 5 times above what is recommended in medical textbooks, then you will most certainly sustain the ramifications of your lowered level of carbon dioxide. So when I began teaching this, I taught under supervision from my teacher. We taught in groups, in medical clinics, scout halls, town halls, in various other, meeting places, and we saw a reversal of all those chronic diseases. But it is dependent upon the person understanding, because a lot of the advice and the techniques that we would teach are counterintuitive and not easily understood by most people in terms of why would this help? Why would this be effective to reverse these chronic diseases? And it's always for the same reason. It's to reduce the amount of ventilation to the point of to be its optimal norm, and thus improve the level of carbon dioxide within the human organism. And well, it's quite a job. It's quite a job for us to teach and explain and coach and explain the process, because there is a process. Part of that process is the cleansing reactions, where the organism discharges infections, toxins and so forth, and then one must have an understanding approach around symptomatic medications, which on the one hand may improve or ameliorate symptoms, but on the other hand they make the underlying condition worse. And this is why in the West we see the countries which medicate their populations more, those conditions are worse. There is more asthma and more severe asthma and deaths from asthma, for example, in the more advanced Western countries than, for example, in poorer third world countries. Because in the advanced Western countries, the medical industrial complex medicates symptomatically and thus ameliorating the symptoms, but the cost is invariably that the organism discharges even more carbon dioxide. So to ameliorate symptoms with symptomatic medication is seldom a great idea. I'd say it's not an easy method to learn. It requires devotion, it requires effort, and one is well advised to try to understand Buteyko's idea, to try to comprehend what you're doing and why you're trying to do it, so that one can remain objective, because to be objective in practice is to improve your work and your pauses and your breath holding ability and your reduction in breathing when it feels, even when it's counterintuitive. And people see the results very clearly. Sometimes just within days, people notice a slight improvement, and usually after a week of practice, any person, regardless of the severity of their condition, can begin to see authentic, incontrovertible improvement. But I should say that it requires a bit of work. It requires you to pay attention. It requires coaching, and it requires, I'm reluctant to use the word devotion, but I would say a very sincere application, and one must practice 3 or 4 times a day. You have to make some lifestyle changes, obviously, that will help the practice to make augment your practice. What else can I say? Well, if you look it up on the internet and you're fortunate enough to find good literature, you can begin to see Buteyko's ideas. and how they can and should be implemented. And of course, you will see lots of positive testimonials demonstrating how people have been able to reverse their asthma, take off their allergies, to normalize their blood pressure, for them to have very significant weight loss for those who are overweight, and for those who are underweight, they can gain weight because this process is one of normalization. What concerned Professor Buteyko very much, and perhaps what made him so devoted to his task of this lifelong crusade, was he saw that the control pause of contemporary people becoming worse and worse and worse, and lower and lower and lower. And and this explains why we are seeing more diabetes mellitus, for example. 30 years ago, ask any of your doctor friends how many of their patients had diabetes mellitus 30 years ago. It was almost considered a rare disease. Some doctors would even be proud to have patients that had diabetes mellitus. Ask any school teacher about children with asthma. 30 years ago, they would tell you that, oh, maybe one child out of every 2 or 3 classrooms might have asthma. While these days, you'll have 3 or 4 or 5, even in one classroom, that have asthma. We talk about depression, mental depression. Now, when the Germans were bombing England and people were losing loved ones and buildings were being destroyed, depression was, well, it wasn't even considered a serious medical issue. Most certainly, it was barely understood. And these days, when, up until recently, the economy was doing well, the world was advancing and so forth, and now we're finding depression has become extremely common. The same can be said with high blood pressure. Once again, 20, 30 years ago, high blood pressure was, a fairly rare disease. These days, anyone over 50 years old is at risk of having high blood pressure. And obesity, I don't need to even talk much about obesity. Anybody who is more than 50 years old can see what's happened with respect to obesity in our contemporary society. It's become, well, there were always people who were overweight, even in the Dark Ages, but these days, in many countries like the United States and Australia, Canada, UK and so forth, being mildly obese is basically the norm. And we're even seeing it come to Asia now, countries like Thailand and so forth, where obesity was truly a peculiarity, has now become a common sight on the streets. So I would encourage everyone to investigate, make inquiry, inform yourselves about the Buteyko method, do some research, and try to understand Buteyko's ideas. And naturally, we'll be holding online workshops. Our online workshops are held with a video conferencing setup, so it's much more reliable than the system that we've been using for these public presentations. Occasionally they might drop out a little bit, but they're a lot more reliable and they're fully interactive, so we can talk to patients and they can ask questions quite easily and so forth, and we can successfully teach the Buteyko method to people online. I would invite people to ask questions. If there's anyone who's got a question, I'll try and answer it. I haven't got any questions here yet. Once again, I really apologise about this this technical stuff. Okay. Getting some questions now. Hope I can answer them. Someone wrote, who wrote this? Someone has written, what can I already start doing daily to become more of a healthy breather, to gain more health? Well, the first thing to do is to understand about your breathing. The first thing to do is to check it. And I would do a control pause and check your breathing. If your control pause is 50 or 60 seconds, don't worry about your breathing. You have nothing to be concerned about. If your control pause is lower than, say, 30 seconds or so, and 20, and even worse than that, then you should begin by understanding that you need to breathe less. You should not mouth breathe. You should not sleep on your back. You should not eat high-protein foods, because all these things increase your breathing. If you do physical exertion, do it with the mouth closed. And if you require to breathe more during exertion, slow down your exertion so you hyperventilate as little as possible. The idea, once again, to breathe less. If you eat less, sleep less, do more physical work, but ensuring that you never become breathless. I mean, you can check this out. I mean, what I'm saying is not a cult. It's not hidden. If you look at the how heart attacks develop, they start with the breathlessness. People become breathless, then the chest becomes tight, and then there's the infarction. And so it is with asthmatics. They feel breathless to start with. So one should do everything in one's power not to become breathless. If you want to change the involuntary breathing pattern, the only way I know is to be trained and to be coached and to practice. Now, you might think that, he's saying that because he wants us to enroll in his class. Well, it's okay, maybe I do, but from a technical point of view, the gardening tips I can give you won't be enough to change your breathing pattern, but at least you can avoid some problems. At least you can not sleepwalk into a trauma, perhaps. So don't allow yourself to become breathless. Don't breathe deeply. Don't breathe through the mouth. Don't sleep on your back. Don't overeat. If you exert yourself, ensure that your mouth is closed and that you try to limit your breathing. Maybe someone's asked another question. Ravi writes, I wrote in Delhi due to pollution there is a high level of asthma. Should cure a patient, and if it works then have a camp, since individual treatment is expensive and unaffordable. Okay, well the first thing is about pollution. Ravi, understand this, that the highest levels of asthma are not in the most polluted countries. Now, I'm not saying that pollution doesn't trigger asthma. It might. It does, most likely. And people in China, people in India, and other countries are complaining about the increasing levels of pollution and the increase in the symptoms of asthma and so forth. But the fact is, the highest rates of asthma are in Australia and New Zealand, and it doesn't get much cleaner than New Zealand. Not to speak of Switzerland, which also has very high levels of asthma. So, yes, pollution is not a good thing. If you hyperventilate and the air is polluted, you'll be even more poisoned by the pollution. But pollution as such, I mean, there is a kind of pollution which can just kill you stone dead. I'm just talking about regular pollution. We are seeing that it is the symptomatic treatment which creates the highest levels of asthma in the Western world. Pollution doesn't help, but pollution is obviously not the cause. If it was the cause, the cleanest countries in the world would have the lowest rates of asthma, and that's not true. In fact, the opposite is true. So one needs to retrain one's breathing, and particularly if you live in a polluted place, it's twice as bad to overbreathe, because you are now ingesting and breathing more deeply in your polluted environment. Reg asks, is it okay to do hot yoga whilst doing Buteyko? Well, you know, first one must define what is Buteyko. Buteyko method is the idea to breathe within the physiologically recommended norms. And if you breathe too much, to try to reduce your breathing. So, doesn't matter if you're having hot yoga, if you're doing sex, if you're riding a push bike, if you're doing work in the gym, if you're relaxing, watching television or whatever, you should do or incorporate Professor Buteyko's ideas. As far as yoga is concerned, if you use the Bhagavad Gita as a guide, you will find the objective of yoga is to suspend the breath in the nostrils, to make the breath light and shallow, and to make it as small as possible. That's what the Bhagavad Gita, that's how the Bhagavad Gita describes yoga. I'm not quite sure I understand what is going on with all this deep breathing and so forth. But people claim that it's yoga when the Bhagavad Gita says something quite the reverse. I'll see. Sandra writes, how will I know what workshop fits me? Well, just if when you're in touch with us, if there's a patient information form, you can fill out or just inform us by email about your particular condition and so forth, and we'll make sure that you're in the right workshop for your particular requirements. It's interesting because, you know, we've always taught this bricks and mortar. We've taught via Skype to groups and so forth, but there's been a practitioner with the group and I've intervened with Skype. But prior to that, we always taught in live groups, Harley Street in London, Hale Clinic, all kinds of places. We've been teaching this method all over the world, basically. And this is the first time that we're aiming to do everything online, in the sense that so that people from different countries can come in. Now, when it comes to workshops, our system is quite robust and reliable, and we can coach and explain, and you can ask questions easily, and we practice together, and we show you the techniques. And then, of course, there's lots of follow-up, because you need to know, how to deal with symptoms, what to do with medications, how to explain to your doctor the changes under which your body is going, and so forth. And so we have a robust system for that. And we thought that, you know, incorporating all this online is going to be quite easy, particularly these presentations. But it's been absolutely shambolic. So for those of you who have been, you know, disappointed by our ability to organise our, you know, workshops online and things like that, I must apologise. We went into all this with the very best of intentions, and we found that we've been temporarily defeated by technical difficulties, but we'll overcome those, and we're quite determined to persistently bring Buteyko's method, ideas and training online and so forth. So I hope that you'll be patient with us around this, and for those of you who are impatient, we have to learn to be patient. Sandra writes, how do you look at deep breathing during tantric practices and rebirthing, for example? Well, there's not a single shred that deep breathing has any benefit to the organism whatsoever. Like blood pressure, body temperature, pulse, and so forth, sugar levels and whatever, the organism has its optimal. And the optimal for the human organism at rest is 3 to 4 litres a minute. If you have optimal breathing and you temporarily deepen it to create some kind of a sensation, well, you know, I don't really have much of a comment on that. You know, I hope that you get the sensation that you want. If, however, you are already breathing 3, 4, or 5 times more than you should, you're a mental wreck, you're obese, you have asthma, allergies, angina, neurosis, insomnia, and then you are going to practice more deep breathing, then this is like a man who is impoverished going to the casino and spending his last penny on the roulette wheel. If you're a multi-millionaire and you decide that you would enjoy a flutter at a casino and lose 10 or 20,000 pounds, I think it's fine. It may be excellent entertainment. But if you are deficient in resources and then you go to a casino and play some high-risk gambling, then it's not advisable. So likewise, with these deep breathing exercises, I cannot comprehend how they can produce anything beneficial whatsoever. I have observed rebirthing, and what I see is induced psychosis, not anything healthy, but that's entirely, you know, for the people who are into that. Can the reduced, Georgiana writes, can the reduced breathing be practiced after a hernia surgery? Yes, it can. However, you should not practice the reduction of breathing until a surgical intervention has healed. And the reason for this, and this is the same with the tooth extraction or any kind of operation, is because the viscosity of blood will be reduced. In other words, blood will become thinner if you practice Buteyko method. And if you want the blood to clot, you shouldn't be doing breath holding exercises and Buteyko method, because that will not assist the process. So once the hernia operation, or for that matter any surgical procedure, once the healing has started and there is some tissue security, you can revert to practicing Buteyko method, and there's no harm or no problem with that. If, however, you practiced too early after a surgical intervention, then you may delay the rate at which the surgery will heal. Suzanne asks, what is actually causing people to breathe ever faster? Buteyko claimed, well, it's actually not just faster, it's the depth of breathing. And Professor Buteyko claimed that it's to do with society and the direction in which society is moving, and has a lot to do with, it's multifactorial. One of the issues that he took particular exception to was what he called the deep breathing principle of greed. Now, I'm not suggesting that sick people are greedy and that's why they've become sick. But society as a whole has, and it's not really the individual's fault as such, but it's somehow how we've been brought up and trained and disciplined, that we are very much for ourselves, and very much, greed as such has become part of our DNA. It's not the individual necessarily, but it's the direction of the world. And this, along with the stress of, you need more income, you need to work more, you need to compete. I think the elements of pollution, and rotten food, and all these stressors don't particularly help. They probably acerbate the situation. But the generalized overreach and the lack of contentment and the urgency to the grasping which we see in society is one of the causes of the deepening of the breath. And if we look at today's world, the lack of empathy and the urgent overreaching greed to grasp and to overtake one's fellows and so forth has gone from a antisocial behaviour to the norm, and we see that these days, such violence, stupidity, aggression, and so forth. So, and Professor Buteyko actually said that when the control pause, the average control pause of contemporary society, when the average reaches 15 seconds, society will literally collapse on itself, because people will be so ill, so stupid, so unable to function, and so naturally so malevolent that society itself will cave in. And it looks like it's going in that direction, because we see some of the, if you look at what's happening in the world, it makes no sense at all. You probably knew that already. Aisling writes, I have a feeling that I need to breathe deeper and a feeling of stress in my chest. Will the Buteyko help me with reducing the feeling of stress? Well, would you believe that this feeling, air hunger, is actually produced by that respiratory center I was telling you about? It's actually created in the brain. And so you develop this feeling that you haven't got enough air. Now, look at somebody like a person who suffers with emphysema or COPD. They actually dream about being able to breathe more. They are already breathing 3, 5, 6, or maybe even 10 times more than they should. And as a consequence, they have all this damage to their bronchus and so forth. And yet, they're breathing 3, 4, 5 times more than they should, and they want to breathe even more. They can't get that satisfying deep breath. So it's actually, it does feel like that, but it's not true. It's actually counterintuitive. And that tightness or stress you feel in the chest, once you've elevated the level of CO2 by doing these counterintuitive breath holds, and if you are coached properly and that you practice regularly, you'll find that you can quite happily breathe less and less and less until, and it even gets to a stage when the idea of breathing deeply is just disgusting, and the idea of breathing less is a pleasure. wouldn't seem like that now to you, of course, but it does when you have practiced for a little while. Sandra writes, and how about sometimes we take this deep breath, like a deep sigh and yawning? These seem natural impulses. What is it for, or what is the strangeness about it? Well, once again, this respiratory center requires the organism to discharge CO2 in order for its equilibrium to be maintained. So if your involuntary breathing pattern it can't discharge CO2, it will cause you to yawn or to sigh and so forth. So it doesn't really matter if within half an hour, if I give you $10 every minute, or at the end of 1 hour, I give you that total. Hang on, this is a very bad analogy. Let me put it another way. If you earn $1 a minute and you get paid $1 per minute, or you get paid $60 every hour, it's the same thing, isn't it? It wouldn't really matter if you've got $61 notes piled up that you accumulate every hour, every minute, or at every 60 minutes you get $60, or every 30 minutes you got paid $30. On the whole, it's the same. So it doesn't really matter if you are persistently over-breathing by a small amount, or from time to time you feel the urge to sigh. It's basically the same thing. And it will, if you are over-breathing, it will mean the discharge of CO2 and thus the genesis of all kinds of chronic health problems. From Reg, how long does it take to reduce HIFG, I presume you mean high blood pressure, and what cleansing reactions can I expect? Depends, Reg, if you're taking blood pressure medications or not, and what other health issues you have, and what your control cause is. But with high blood pressure, usually within a couple of weeks. And in fact, if you monitor your blood pressure very carefully and very frequently, you will notice that you've got lows, mediums, and highs, and you will start to see that if the mean average begins to drop, usually within about a week or so. But to normalize blood pressure, without knowing some more details about your situation, and I'm not trying to obscure any information here, but you would notice improvement within a week, and if high blood pressure is the only issue, there's not something else behind it. Because you see, why would the organism increase the blood pressure? That would be to increase perfusion and diffusion so that vital organs get the oxygen they need. Now, if there's oxygen deficiency, a deficiency in metabolizing oxygen, blood pressure will be increased so that perfusion and diffusion becomes more vital. Now, if you begin Buteyko method, it's not that the blood pressure will improve straight away. Most likely, the rate at which oxygen comes off hemoglobin and into cells and tissue will be improved. And as a consequence of this, the vasometer will eventually lower, and you'll find that your pulse will lower, and then your blood pressure will lower, and then your pulse will go up, and your blood pressure will go down, and so they will sync off each other. But as and when your control course improves, according and quite linear to this improvement, your blood pressure will normalize. As for cleansing reactions, it once again depends. And once again, I'm not trying to be evasive. If you have toxicity, if you have infections, then those toxins and those infections, to the extent they contribute to your hyperventilation and they contribute to your underlying condition, they will need to be discharged. So with small children, for example, to give you an idea, Reg, small children, 8, 9, 10 years old, their cleansing reactions consist of a little bit of diarrhea, they get a little bit of a temperature for a very short period of time, and they might get a little bit of body odor, and that's it. Some people have very few cleansing reactions, not much at all, but those people who have a high degree of toxicity and they have numerous infections and things going on, their cleansing reactions can go on, and you can feel quite, a day of being a bit nauseous and feeling a bit fluey and a bit fatigued and a bit off. But that comes and goes, and eventually the infections are taken off, and the whole organism becomes more robust and more vital. So I would not be against having cleansing reactions. Without cleansing reactions, there's no proper reversal of disease. So better out than in, as they say. Right. When is next Monday's workshop?
What time?
Is it this coming Monday?
I think so.
Well, my assistant here has reminded me that I should talk about our next workshop, and I'm ashamed to say I don't have the details for that. But if you go onto the website, learnbuteykoonline.com, you will find that we have a workshop beginning on Monday. And what date? That never sent me the dates. Right. It's a basic 5-day workshop, January the 6th.
Same time as this.
At the same time as now. Right. Okay. Right. Starting January the 6th, Monday to Friday, and it starts the same time as this started. You're going to, you have to be ready for work, and you have to practice 3 or 4 times a day. Just attending the workshop won't be enough. You'll need to practice 15, 20 minutes before breakfast, lunch, dinner, and bed. If you've got symptoms, and I know this may sound a little odd, but we prefer patients with symptoms. Why? Because they get obvious results. So those people with asthma, allergies, tight chest, angina, high blood pressure, migraine headaches, constipation, arthritis, and so forth, we welcome you to this workshop. You will need to practice. You'll need to send in your forms so we can properly analyze your situation and give you the right individual advice. There will be follow-up and so forth, and we are very much looking forward to that event. If you're not sure if this is for you, you don't need to rush into this workshop. You can attend a few more presentations. You can look at our website, read the material, try to get it, because this is not a magic method. This is not, I'm not a healer. I'm not a healer. I teach you some scientific information. We coach you how to practice it. You will make mistakes which will need to be corrected, and you will have reactions which they need to be explained to you, how to deal with them, and you need to become skillful. This is very much like playing golf, learning, how to throw a dart, or judo, or karate, or any other skillful job which needs to be learned, practiced, and of course you always need coaching in this. And everyone's needs are a little different according to their circumstances. So, you should be ready for work and you should be ready to apply yourself. If your control pause improves, don't worry about your results. You will see. They'll be self-evident. But I can tell you, if your control pause does not improve, if your breathing does not change because of this workshop, even if you pay us money to attend, your symptoms will not improve. Your condition will not improve. It will only improve if you apply yourself. And if you apply yourself, the results are self-evident, because Buteyko method, in terms of its physiological impact on the organism, is very much a cause and effect thing. So, after giving you all that negative stuff about joining the workshop, I hope that some people attend. But I've had the privilege to be teaching this method for just on 20 years. And I can say this, hand on heart. All people who practice and improve their breathing, all of them get positive results. Now, there have been quite a few which somehow couldn't manage to get their breathing improved, or had difficulties, or contradictions, or they didn't do the work for whatever reasons. And of course they did not do as well. But all those who were able to improve their breathing through their willpower and persistent efforts, I can say, hand on heart, none of nearly, I think it's more than 20,000 students that I've worked with, none of them have been disappointed with, with their improvement, which is linear to the work and the results they're able to achieve. I don't think there's anything else to say. I think I'm worn out. I'd like to, are we done? We're done. No. Once again, I'd like to apologize for our technical fiasco. In the future, we're probably going to change systems so that we're able to deliver these presentations a little more, in a better way. And for those of you who will join us in our workshop, I look forward to meeting and working with you. And to everyone else, I thank you for your very kind attention and patience today, and look forward to hopefully seeing and hearing from you again soon. Okay, bye-bye.